And so here's the question for Dr. Kevin Kavanagh. When this thing is over, Dr. Kavanagh, are you going to go back to shaking hands?
Well, might do fist bumps.
Okay. Not shaking hands, though. I don't think I will either. I think I'm with you on that.
Yeah.
How are you this morning?
I'm doing really good, sir.
Good. Well, it's getting scary. I mean, it's been scary, but now we're hearing close to home here, red or orange zones, Jessamine County, Boyle County. What's happening?
Well, things are spiking. Our test positivity rate's now up over 5%. And our deaths they're increasing too, unfortunately. The 7-day average I have is 12 now. Before it was down to 6 or even below. So it's kind of scary at this point, Jack. I think that our hospitalizations are going up and people really do need to abide by public health advice. This is how we've controlled SARS. This is how they controlled MERS, how they controlled Ebola. It's worked before, and that's masks, social distancing, hand hygiene, and reducing contact with others, because we really are starting to spike.
Now, I see a study here that says 2 new peer-reviewed studies showing a sharp drop in mortality among hospitalized COVID patients.
That's true, and that's good news, and that's actually comparing the death rate from, remember, our first bump to the second bump, and we did better on the second time. Even though our mortality was up, it was not as high as our first wave, and of course we had much more cases. They attribute that to physicians getting better in treating the disease. They also feel that wearing masks may help because it decreases your viral load. Remember, there's a theory that, well, if you wear a mask, you won't get as many viruses in the first place. Therefore, it gives your body more time to generate antibodies. Remember, it's kind of a competition between the virus and the body on whether the virus can make more viruses or you can make more antibodies, and who can do it quicker. The more viruses that start in the beginning, the further ahead the virus is at winning that race. And also, we're seeing younger people getting hospitalized and spreading the infection, as a lot of the older people who are in nursing homes have been sheltered from the infection. Of course, that unfortunately means cut off from society and loved ones, and after 6 months, and who knows how long it will have to be, that is an extremely, extremely terrible thing to have happen.
Tell us about this experiment, I guess you'd call it, going on, human challenge, if you will, where they're going to start deliberately infecting people with the coronavirus.
Well, this is possibly going to go on in England. It still needs to have final ethics approval, but it's getting a lot of press. And that is a challenge trial where you actually give the virus to individuals, and then you have a placebo group, a group that gets a vaccine that isn't a vaccine, and a experimental group. It's blinded, and they can get faster results that way. Well, there are 2 problems with this, and this is why it is very, very controversial. One is that you have a group of patients, even though they're young and healthy, that are getting a virus that there's no treatment for, and that it can cause them significant disability, even with a chance of death. As we talked to you before, Jack, the fact that you don't die of this virus isn't necessarily the biggest problem you may face, because you may have chronic heart disease and lung disease. And I know that's bad to say that that may be worse than death, but to be young and chronically disabled is an extremely bad thing to have happen. So they may be facing that, and this virus has no treatment. The other big question is will it give you the information you need? Because this virus affects primarily the elderly. And this vaccine won't be tested on the elderly in a challenge trial. As you know, with the flu vaccine, if you're over 65, you have to get a different type of vaccine. So this is why this is problematic. It may pose undue risk on young, healthy individuals, and it may not truly give us the information that we need. On the other hand, proponents will say, yes, but we can get some information quite quickly that may point us in the direction of which of these hundreds of vaccines which are coming on board could be used, and which may be better, and we could start studying that group first. So we'll just have to see how the ethical boards will rule on this one.
All right. Dr. Kevin Kavanagh, thank you so much.
All right. Thank you, Jack.